Johannesburg, May 2025, WorldWire News. South Africa, home to the largest HIV-positive population in the world, is grappling with a new crisis, a sharp decline in HIV testing rates following recent cuts in US aid. The effects of this funding shortfall are already being felt nationwide, particularly among pregnant women, young adults, and infants, groups that are historically most vulnerable to HIV transmission. While this setback has been developing over several months, the gravity of the situation has now come into full view. According to the National Health Laboratory Service, NHLS, viral load testing has dropped by as much as 21% in recent months. Testing among individuals aged 15 to 24, who represent a significant portion of new infections, has plummeted, and mother-to-child transmission risk has increased, due to reduced prenatal screenings. This trend threatens to reverse decades of progress made in fighting HIV/AIDS in South Africa. The question now isn't whether action is needed, it's how fast and how effectively the South African government can step in to avert a public health catastrophe. Understanding the crisis, the funding cut from the United States, once South Africa's most significant external backer in the fight against HIV, has disrupted testing infrastructure, reagent supplies, and personnel payrolls in clinics nationwide. Thousands of healthcare workers funded through US partnerships have been laid off. As a result, many rural and township clinics have either shut down or reduced operations to the bare minimum. These clinics were not just test centers, they were lifelines. They provided ARV, antiretroviral, treatment, conducted follow-ups for patients, tracked viral loads, and supported education campaigns. Their absence is now being felt most acutely in poor communities, where health literacy is low, and HIV stigma remains a challenge. Impact on pregnant women and youth. The collapse in testing services for pregnant women is particularly concerning. South Africa has made significant strides in reducing mother-to-child HIV transmission through early detection and treatment. Without early testing, this progress is in jeopardy, risking a new generation of HIV-positive infants. Similarly, young adults are less likely to seek out testing when services are not easily accessible, or when clinics are understaffed. Reduced outreach and school-based education programs also mean that risky behaviors are going unchecked. What the South African government must do. The response from the South African government must be immediate, bold, and strategic. Piecemeal efforts will not suffice. Here are 6 actionable steps the government must consider. 1. Declare an HIV testing emergency. President Cyril Ramaphosa's administration must declare this a national public health emergency. This will unlock disaster funds, expedite procurement processes, and signal the urgency of the situation to both the public and international partners. 2. Redirect budget priorities. The government must reassess current budget allocations to ensure HIV prevention programs are not sidelined. Redirecting funds from non-essential projects to re-establish basic HIV services, especially in hard-hit rural provinces, should be an immediate priority. 3. Deploy mobile testing units. The Department of Health can scale up mobile testing clinics to reach underserved communities, particularly where fixed facilities have closed. These units should also carry out supplies and provide basic counseling services. 4. Partner with the private sector, engaging private labs, pharmacies, and medical practitioners to provide subsidized or free HIV testing can help close the service gap. Tax incentives and government-backed procurement deals can facilitate this partnership. 5. Expand local manufacturing of test kits and reagents. South Africa must reduce its dependence on foreign donors for basic supplies. Investing in local biotech manufacturing will not only stabilize supply chains but also create jobs and bolster the health economy. 6. Rebuild community trust through campaigns. The decline in testing is also linked to reduced outreach and misinformation. The government should relaunch grassroots HIV awareness campaigns through radio, TV, social media, and local influencers to encourage voluntary testing and reduce stigma. The global context. While the US decision to cut aid was part of a broader shift in foreign policy, the fallout has shown how deeply interconnected global health funding is with domestic public health outcomes. South Africa, as a regional powerhouse, must now demonstrate that it can lead its own health revolution. International partners such as the Global Fund and UNAIDS have offered support to fill some of the funding gaps, but this aid must be matched by a strong, coordinated local response. A moment of reckoning. South Africa's fight against HIV has been a long and hard one, marked by victories, setbacks, and incredible resilience. But this moment may prove to be the most defining yet. Failing to act now will not just roll back years of progress, it will endanger the lives of millions of South Africans, particularly the youngest and most vulnerable. This is a moment for leadership, not complacency. For urgency, not bureaucracy. For action, not excuses. By WorldWire News Health and Policy Desk for Truth. For justice. For the people.